We're the only large, wealthy, industrialized country in the world that doesn't have universal access to healthcare. You go anywhere else, Canada, most European countries, there's universal access, meaning every single person who lives in it and is a citizen of that country has access to healthcare. That is not true in the United States.
For those that can no longer afford insurance or that don't have insurance, now there is an opportunity.
Sometimes people just get stuck in a loop of not being cared for, and they don't know where to turn.
Sometimes they have limited resources. They may have insurance, but they can't afford the high deductibles and copays now that come with lots of insurance plans. So we're there to help.
For many people, insurance is not there, number one. Number two, it may not cover the procedure. So that's where we come in.
I had worked as a surgeon with the Patient Benefit Foundation for years, and that provided a great opportunity to help the community. But I was looking to do something more. And so when Dr. Chaudhry asked if I was willing to join the board, I thought this was a great opportunity to not only be a surgeon, but also be a board member to help provide more service to the community.
Doctors are volunteering their time with Patient Benefit Foundation because they believe in giving back and because they've seen patients over the years that haven't been able to get services.
I truly do feel that those of us who can should help others.
Hi, my name is Mubashir Chaudhry. I'm a foreign physician. I graduated from Pakistan from a medical school, and eventually I practiced a few years before migrating to the United States. My father was naturally a biologist and teaching in a college. His dream was to see me as a doctor, and he suggested that I will coach you, I will teach you just like I do others, and all the people get benefit from me. So why not you as well? I agreed. Then he gave me the game plan, how to prepare myself. It meant the world to me, and because generally he was tough with me. When I grew up watching him helping those students who had no resource, when I saw that, it was in me to begin with.
इस तरह की फाउंडेशन होनी चाहिए, तो फिर इसने काम में इस तरह शुरू किया कि फाउंडेशन के बंदों के सिर अब मुझे फ़ख्र ये है कि मेरे बेटे ने PBF फाउंडेशन बनाई लोगों के इलाज के लिए, और किसी काम का ये इरादा कर ले तो करके छोड़ता है.
My mother migrated to this country after my father passed away, and obviously she did not have insurance to cover her medical benefits. She had to go through worst experience of her life. My mother ended up in ICU because her pancreatic enzymes were very high at that point. And this is a very critical, stage. A patient can die with it, which was my reason to be prompted about, creation a platform and resource for the patients. So my mother became the real reason. I had the passion that combined with the resources, the tools that I had. She was a motivation, and when I discussed the idea of the Patient Benefit Foundation with her, she equally participated in supporting this organization to be established.
I'm self-employed. I'm a business owner, so I don't have health insurance. My wife carries the insurance, but she's in between jobs. She wasn't eligible yet. It was that probationary period. In between cuts, I'd have to lay down just to get some relief, and I just got tired of doing that. So when I went to the doctor, he told me I had a hernia. That pain was pretty intense. It was a big inconvenience for me and my clients. And it really concerned me because once I went to the doctor, they told me if it exploded, I could die. Called Cobra to see if we could be covered in between the insurance period, and they referred us to the Patient Benefit Foundation. Here it is 4 years later. I move around a lot better. You can't even tell I had surgery. I'm back to roller skating. It doesn't bother me to stand on my feet for a long period of time now, so all is good. I'm back to having fun. It was no fun dealing with that pain. You know, I didn't want to skate because of the pain. You know, I didn't want to go to the gym because of the pain. But now, you know, at 54 years old, you know, I'm back to skating twice a week. I'm hosting my events. I'm going out of town with my events. So I'm back to having fun. So, yay.
For people who don't think that it's real, that it's too good to be true, I would just like them to know that it is true. We do help people. We want people to be able to be pain-free, be able to move, be able to do the things that they used to do before they needed a surgery. I am one of the founding members with Dr. Chaudhry. We started the foundation back in 2014 and started doing surgeries a little bit after that. I've been on the board since the beginning. I am a breast cancer survivor. In 2018, I found out that I had breast cancer and had 3 surgeries actually in 2019. I had a very hard time being seen, and it was very frustrating for me as a person who's a clinician, and I had to struggle for weeks to be seen by doctors, get testing done, and finally find out that I did truly have the cancer. I can imagine that people who don't have insurance and aren't in a medical profession at all really struggle. So advocacy for people and patients is a very big thing for me anyway. Telling people and making people aware is very important. And the only way that we can do that is to keep talking about Patient Benefit Foundation.
It's a charity. It does not request any sort of payment to the doctors, to the facilities, back to the foundation. It's there to provide help to those who need it. And that's one of the reasons that I love being with the foundation, because it's truly all about patients and benefits, not about anything else. It's just how do we get good care to people who need the help.
When I retired a few years ago, he asked me to join the board of directors of the Patient Benefit Foundation. And so I've been doing that and helping with raising awareness about the foundation as much as anything else in the last few years. The Patient Benefit Foundation is a very unique organization in my experience. We're helping people who need something that's going to improve their quality of life. It isn't necessarily life-threatening, but it is something that needs to happen.
The American insurance system is pretty much broken. You're paying a lot of money for something and you're not able to be seen in some instances, or your deductibles are so high.
So health insurance is very interesting. We're probably the only industrialized nation in the world that uses a system of private health insurance to pay for health care. So in the US, about 50% of care is paid for by the government through programs like Medicare and Medicaid. The other 50% is paid for by private health insurance, mostly which people gain through employment. So if you're unemployed and you have to buy your own health insurance, it can be very, very expensive. As a result, a lot of people, they don't even go through the health exchanges. So any kind of a health crisis, something that comes up where they need care, it becomes financially prohibitive.
Americans are paying more than they ever have for insurance before. Doctors are overwhelmed, emergency rooms are overwhelmed, and that's where something like the Patient Benefit Foundation can help, because for those that can no longer afford insurance or that don't have insurance, now there is an opportunity for them to get the elective surgical care they need.
I saw in many patients that we treated, patient had insurance, but they will not qualify that patient to have that knee surgery or whatever surgery that is. Denying that patient is not the right thing to do. But there's no check on that.
Some surgeries that are medically necessary, in a physician's opinion, may be denied by a health insurance company. And one of the reasons insurance companies deny that is basically just to save money. The way an insurance company determines necessity may differ from a referring physician. We used to use the term elective surgery, but now we've kind of gone to medically necessary surgery. that's not life-threatening. I mean, for example, someone who is in a car accident and has, serious injuries, those can be life-threatening. Those can't wait. Those are going to get treated in an emergency department somewhere, regardless if the person has insurance or not. We're not going to get involved in those kinds of situations. Ours is more a situation where someone who may need surgery medically, but it can wait. It's something that can be scheduled. For example, someone who might need orthopedic surgery to correct an issue that's inconvenient, that maybe even keeps them from working, but they don't have the money to pay for that surgery. Something as simple as a woman needing a hysterectomy. I mean, generally speaking, those are not life-threatening in most cases, but medically necessary. We actually make arrangements working with them, with their physician or another physician that works with us and the hospital, wherever the surgery needs to occur, and we pay the providers directly, as not only for the surgery, but any follow-up care that needs to happen as well.
The day of the surgery, I showed up at the hospital. I was there early. They got me checked in. They prepped me for surgery. Everything went great. Everything was smooth. When I got the bill, I actually called my representative and let them know I got that bill. He informed me just to forward it to them and they would take care of it. I scanned it, I emailed it to them. I haven't heard about it since.
When the patient shows up for surgery, it's all very seamless. Just like with any other patient, they come in, they get the surgery, they go home, and everybody's happy. You can be certain that if you come to see me, if you see any of the foundation's physicians, that we will do everything we can to do good, high quality, safe surgery.
It doesn't require a whole lot of information. We do a little bit of income verification because we want to be sure that we're a 501c3 organization, so by IRS regulation, we're required to verify that we are providing services to people who do have a financial need. So I think the way it's set up and the way it's organized is really smart and to some degree a little bit different than some other organizations that do provide some kind of medical assistance to people.
The Patient Benefit Foundation would like to grow. The more funds they can raise, the more care they can provide to our community. And especially now with the economy, with inflation up, the more the foundation can do, the better. And that requires work from all of us, not just from me as a surgeon providing no-cost care, but also from those who donate to the foundation who want to help our community.
You can really get a broader vision of helping more people, really raising more and more funds in order to reach out to a larger population.
As long as I live and I can, I will not charge anybody any co-payment or anything like that. I believe the future of the organization is to reach out multiple cities in the United States and reach every corner. I'm really grateful to the support staff I have in my organization, and I believe that I won't be able to accomplish anything without their help. This support system is very important. Each one of them is really handpicked and meant for this job. My mission is to reach out to every person who needs an elective surgery or diagnostic procedure or help with the deductible when they cannot afford it, when they are in need.